Hey, good morning, everyone, and welcome back to Public Affairs on Peach. We are back this morning with Dr. Heavenly Kimes, certified dentist right here in Metro Atlanta. Dr. Kimes, good to have you here with us today.
Thank you.
Let's talk about getting a child to brush their teeth, because I can only assume how hard it is sometimes to get adults to do it, to get the kids to do it. At what age should a child have their first dental appointment?
Well, usually we recommend it around the age of 2 because their teeth are in, their primary teeth are in at the age of 2. Before that, if it's a concern, if you have a concern where you see a problem, an abscess or things like that, I would say bring them in earlier. But 2, that's when usually their primary teeth are in.
Okay, so is there a difference between a child's toothpaste and an adult toothpaste?
Most definitely. A child's toothpaste probably tastes a little bit better, so they will brush.
Got it.
So, yeah.
So just more flavor-esque than it is
Definitely.
anything of the chemical compound that you wouldn't want maybe your kids to have. It's just about taste.
Taste.
All right,
So they'll
taste
brush.
and getting in the habit. All right, when does flossing begin for a kid?
Usually the primary teeth don't need as much floss because there's a natural space between primary teeth. So usually we don't recommend flossing right away with primary teeth.
All right, very good. How young is too young for braces?
Braces, you want to wait till primarily that the most of the permanent teeth are already in. Usually they attach them to the first molars in the back.
Right.
So definitely 7 or 8 will bring them in for a consultation, but usually 11 or 12 is the ideal age for braces when all the permanent teeth are in.
What about some of the other stuff out there on the market? You've got Invisalign out there, you've got braces. I mean, what do you really recommend for a child to kind of go through that?
I do not recommend Invisalign. Invisalign is for minor tooth movement, probably for adults. But braces, they actually get pretty good results in our office. 7 or above, we bring them in for a consultation to determine what age we want to bring them in. But usually 12 or 13, when all their primary teeth are gone, that's when we'll.
How long does a kid usually have braces for?
Usually 2 years, about 24 months, depending on the condition. Now, if they have a class 3 bite, it could be 4 years. But
wow, that's incredible stuff. All right. What are the insurance pitfalls parents need to be aware of?
Well, it depends on which insurance you pick. Because
Listen, I've got Delta Dental, and I can say this on air. Listen, I'm surprised that they don't cover more than what they do. Now, that could just be me griping about going to the dentist's office and they only pay about 50% of this.
Right.
Or, it's like, no, I got to get a crown. You should pay for all of it, but they don't do that.
No, actually, the major dental treatment, they'll usually cover half.
Right.
For something preventative, they'll cover usually most of it. For something basic, about 80%. But depending on your insurance. Now, if you get an HMO, what they're going to do is reduce the fee, and you're actually out of pocket for that whole amount.
Wow, incredible stuff. But I think if you had to give a tip to somebody out there, is it good to even just talk to your dental provider to say, hey, listen, if I get a crown, what does my insurance cost? Have that maybe conversation beforehand and see if there's any, other treatments you can do?
I think you should talk to the human resources at your office or the place of
yes,
business.
That's what we need to do. Talk to HR. Why aren't they paying the full price for my crown?
Right, because they determine what type of insurance you get. If you get a traditional plan, they're going to cover more. If you get an HMO plan, they're not going to cover as much.
All right, very good. And what services are commonly not covered?
Usually cosmetic stuff. They're starting to cover implants now. But most insurances will not cover implants.
Really?
Or major bone grafting, big things like that. You might have to go to your medical side.
Now, see, that's interesting. Now, how do they decide what they will cover when it comes to implants?
Ask your insurance company, because it does not make sense to me, but they consider implants cosmetic, meaning that you can get a bridge, you can get a crown, and usually if a tooth is already missing, a lot of insurance companies will put in what they call a missing tooth clause, meaning they won't cover it if you already had that tooth missing.
All right, this may seem a little bit basic here, but again, we're just kind of going through them. 3 things to help keep your teeth healthy. 1, brush and floss daily. Brush after each meal, but especially before bedtime.
Right, because you don't want those bugs on your teeth all night eating at your teeth.
Well, when you put it to you that way, that there are bugs in my mouth, that'll want you to make sure that you brush beforehand. 2, avoid sugary foods. Avoid sticky starches like pasta and glazed breads.
Yeah, that pasta will stay on your teeth a little bit longer than other foods because it's so sticky, it'll stay there. And you know what pasta does? It's a starch. It turns into what?
Sugar.
There you go.
All right, so question for you. You can have sugar,
Definitely.
So as long as you brush right afterward.
I would recommend staying away from sugar.
Well,
but
of course
if
you would. You're a
have
doctor,
to,
but I'm just a regular
brush.
guy that likes his sugar.
That's right.
But when you put sugar in your mouth, how quickly does it start attaching to your teeth?
I think right away. You want to brush right after. If you have a chocolate bar, as soon as you finish it, go brush and floss.
Man, could you imagine being out on a date with somebody? Doctor's like, I have a toothbrush in my purse. She's like, I just want clean teeth.
Yeah.
All right, 3, visit your dentist every
6 months, twice a year. Yes,
twice
sir.
a year. And during that time, what do they do?
What we do is we bring you in, we take x-rays to make sure there are no cavities in between your teeth, and we clean them and make sure there's no problems.
Oh, wait, so some people, and this is just a random question, some people who have calcium deposits on their teeth, what is that from?
Usually it's fluoride staining, or it could be from a different kind of medication they're on.
Can you get that from breastfeeding as a young child, or is that a myth?
If you don't have enough calcium, if the mother does not have enough calcium, yes, you can get those staining on your teeth, yes.
Interesting. We just went back to a myth because I always had that question.